Well, good morning. Thank you so much. And I'd like to thank Mr. Fred Brown very much for this invitation and the Forbes Fund for coordinating this very important discussion. I have enjoyed working with Mr. Brown and many of you and other associates over the last number of months in terms of COVID-19 and health equity, particularly in the Pittsburgh area and Allegheny County, but hopefully something that we can scale up statewide. So certainly COVID-19 continues to be the biggest public health threat that we face in Pennsylvania and we face in the United States and actually globally. Hot off the press today is that we have 119,453 cases of COVID-19 that have been diagnosed in Pennsylvania. That's an increase of 601 today, which is a lot of patients, but that's actually a good number and is half of what we were seeing 3 or 4 weeks ago. 77% of the patients who have had COVID-19 have recovered, which is a very good sign. And we're seeing at the moment some decreased rates of hospitalization and use of ventilators, et cetera. So that is actually pretty good news. We had worked very hard through containment and mitigation efforts and under the governor's leadership to bend the curve in the spring. Then, as did the rest of the country, we saw increases in July, and now we're seeing that decrease again and bending the curve in terms of the number of new cases. Hopefully in preparation for school for our children in some form in the fall. COVID-19 really affects everyone. It affects you, it affects your family, it affects your coworkers, it affects your community. And it certainly has shown, I think, how interconnected we all are, that we are so interconnected in terms of our families, in terms of our neighborhoods, our communities, our cities, our counties, and our Commonwealth, and really the entire nation. I mean, the increases we saw in July were as a direct result of the increases seen in other parts of the country, Florida, Texas, Arizona, California, and then throughout the South, which kind of traveled its way north. So we are all interconnected, and this virus has demonstrated that acutely. It is also shown, and I believe Mr. Brown was kind of talking about that, what lies underneath the iceberg in terms of health disparities is that, we all knew that there were significant health disparities, but they have been revealed even more given the size and scope of the global pandemic of COVID-19. And these are not new health disparities. These are long-standing health disparities that impact vulnerable communities and increase the risk of people having poor health, acute health problems, chronic health problems, getting sick and even dying, which highlights, of course, the importance of health equity. Health equity has always been and always will be one of the cornerstones for the Pennsylvania Department of Health. I know Mr. David Saunders is on the call. He is the director of our Office of Health Equity. He works really closely with Brian Lentis, who's our director of health improvement and things like that in terms of our department. We have always felt that health equity is important. We actually moved the Office of Health Equity out of a specific deputate or department so that it really reports directly to my executive deputy secretary and myself so that it cost cuts the entire department. Clearly, leading a healthy life and health care are fundamental human rights. And so we need to work with everyone so that everybody has access to health care, but everybody has access to the public health benefits that we're trying to expand throughout Pennsylvania. According to the CDC, discrimination, problems in healthcare access and utilization, and what we often call the social determinants of health And that would include, occupation and economic opportunity is a health issue. To me, that's a health issue. A living wage and increasing the minimum wage, which is one of the governor's cornerstones of the administration, is actually, to me, a health issue. Educational opportunity is a health issue. Housing opportunities are health issues. Nutrition, of course, is a health issue. The environment is a health issue. All of these factors influence and contribute to either to health or to risk of health disparities. And clearly in that context, racism is a public health crisis. Racism is a public health crisis. I know that is something that Mr. Brown and the Forbes Foundation has been pushing, and I agree with that 100%. And so we need to take that statement and develop policy from that statement. So, all of this relates to the issues of COVID-19. It relates to other health issues, of course, the risk of hypertension, diabetes, heart disease, lung disease, cancer. All of those are influenced by the social determinants of health and health equity, and so does COVID-19. And again, COVID-19 has exposed many of these inequalities and inequities. And so in Pennsylvania, the data shows that there are significant, unfortunately, health disparities due to access to health care, due to pre-existing health conditions that we just talked about, due to race, due to ethnicity, due to sexual orientation and gender identity, due to food insecurity, due to economics, due to housing, due to education. All has influenced what happens with COVID-19. So we want to work to eliminate those health disparities. It's a priority of the Pennsylvania Department of Health. It's a priority of the Wolf administration. As Mr. Brown mentioned, our vision is a healthy Pennsylvania for all. Is a healthy Pennsylvania for all. Used to be for all citizens, but that's not correct. That's much too limiting. And so our vision now is a healthy Pennsylvania to all. We know that COVID-19 impacts minority communities differently. We're working to collect better data. Without data, it is very hard to articulate and prove your points. You have to have that type of data. I know Mr. Brown, the Forbes Foundation, and the Pittsburgh COVID-19 Black Coalition has been working on collecting, really some fantastic data in Allegheny County and in Pittsburgh. We need to be able to collect that quality data throughout the state. We're making progress. I have ordered that variables such as race and ethnicity, as well as sexual orientation and gender identity, all be on the reports that we get in terms of lab results. I have ordered that. Not everybody is following my orders. We're up to about 65% in terms of reporting of race. That actually is much better. That's probably double what it was in the spring, but it's absolutely not good enough. It's not good enough. We need to get that up to 75%. I'd love to get it over 90%. We're not even doing quite as well in terms of ethnicity, about 40%. That's not nearly good enough. So we have to do better. Really, the healthcare providers and the laboratories, they have to do better, and we have to help them do better. We want to work closely with communities throughout Pennsylvania, such as the Pittsburgh Black COVID-19 Coalition, in order to collect the data better, in order to analyze the data better. I think we want to work on ways to scale the work that you all have done in Allegheny County across the state and even beyond. So, Mr. Brown and I were just speaking that I've connected them with ASTO. ASTO is the Association for State and Territorial Health Officials. So it is the national organization of all the state health officials of the country and the territories. We're going to arrange for Mr. Brown and maybe some of the other presenters to discuss their work in Allegheny County and discuss that nationally as a national model for how to bring really a unique coalition together in terms of academic partners, community partners, the FQHCs, public health, the county health department, the state health department, all together, and see if that can serve as a national model for other states and other communities. So looking forward to making sure that that happens, and helping that connection to inform really my colleagues in other states. So I'd like to thank you all for all the work you're doing through the Forbes Foundation, working towards keeping communities safe and healthy, promoting physical and mental health in general, and particularly given the public health challenges of COVID-19. We want, again, a healthy Pennsylvania all. We want to foster a spirit of tolerance, but not just tolerance, of acceptance and welcoming, really, for everyone in Pennsylvania, and the beautiful tapestry of diversity that we see in Pennsylvania in all of its different aspects. And I am looking forward to continue to work with Mr. Brown and you all to actualize that and make that happen. Thank you.
Thanks so much.
Thank you.
Yeah, thank you so much, Dr. Levine. We really appreciate you being here. And if I may, I'd like to ask some questions that were pre-submitted by our registrants today.
Sure.
First, folks were thinking about going back to school in the fall. And I tried to coalesce some of the different concerns, and just wondering what, from your office and the Department of Health, are some recommendations when different districts are considering how they might return to school or send children to school this fall?
Sure. So critical issue, really, the last number of weeks have all been about schools, particularly K through 12, but also discussions of higher education and colleges. We have been working really closely with the Pennsylvania Department of Education, as well as the governor's office, on school guidance. So there has been school guidance put out by PDE and by the Pennsylvania Department of Health, with some specifics, such as we want children to be 6 feet apart. We've been asked a lot of times whether 6 feet is 6 feet, and actually 6 feet is 6 feet. And also that we want children that are over age 2 to wear masks, as well as the teachers and all the staff to wear masks. Yeah, the lights go up and down and back and forth. And so that's really, really important. We have been asked by everyone, actually, the superintendents, the county commissioners, other public health officials, the legislature, for more specific information and more specific recommendations regarding the opening of school, and then what happens if there are cases in school. So the guidance or recommendations in terms of opening school, whether it is in person, whether it is blended or hybrid, and there are a lot of different ways to do that, or whether it is remote, will be coming out very, very soon. Very soon. So just hold your breath for a couple minutes. So that's all going to be coming out with some specific guidelines. This will not be an order of the governor or myself. These will be recommendations for the superintendents, the school boards to use. We've worked very hard on them. I think that they will be, that they will help a lot. In addition, we will be putting out soon, not as soon, but soon, the recommendations for superintendents and principals and school nurses of what to do when there are cases. That if there's a child who's sick, what to do for the school nurse. If there's a child that's positive, what to do. If there's a teacher that's positive or staff, what to do. If there's an outbreak, what to do. And so all of that will be coming out soon as well. So we have heard the requests for more information, for more tools to be used by the school districts, and we will be answering that. In addition, we've been asked a lot about sports. The governor stated last week that the governor and the Pennsylvania Department of Health, PDE, and the administration feel that youth sports should be postponed until January. And I know that's a real challenge. It's a real challenge. I know many young people depend upon sports for many different health issues and emotional issues, as well as advancement in terms of college, However, given the size and scope of this global pandemic, given some of the new data that has just come out in the last week about children being infected, the rate of children being infected has gone up 4 times. What's happened in a couple other settings, whether they're camps or schools, we really feel that the best chance of having school is not to have school sports. Now, that also is a recommendation and not an order. If there are any more questions, I'm pleased to answer them about schools.
Absolutely. Well, thank you. We're definitely looking forward to those guidelines and recommendations, and we'll see them very soon.
Very soon.
If I might move to testing, we had some questions about that.
Sure.
We have a submission about the current situation of testing for COVID-19, if the state is aiming to make tests available to all residents, and if so, what might be a timeline for that?
Sure. Well, right now, we want testing to be available and accessible for anyone, particularly with symptoms. So we're now, it doesn't have to be, very deathly symptoms. It doesn't have to be that you're in the hospital, but someone who has symptoms, cough, shortness of breath, fever, other types of symptoms, congestion, gastrointestinal symptoms, but someone who has symptoms. We're prioritizing people with symptoms as opposed to population-based surveillance testing. Now, I know in our last conversation with Mr. Brown and the group, there were some discussions of surveillance testing, or as the public health doctor talked about, sentinel testing. And I think that will be really important. To do that widespread right now is a challenge to the testing system. So, this has been a journey in terms of expanding testing. We have expanded testing. We have about 445 testing sites in Pennsylvania. They include testing through FQHCs, which I think is critical to reaching vulnerable populations. Testing through hospitals and health systems and many of their testing sites, as well as testing through Rite Aids, CVS, Walgreens, Walmart, et cetera, which provides a lot of accessibility to people. So we want to make testing even more accessible to anybody with symptoms. Eventually, in a number of different ways, we are discussing that type of surveillance or sentinel testing and how to accomplish that. And we're still working on that. The best way to do that would be have, accurate, rapid point of care tests that can be ready in 15 or 20 minutes. That's evolving, but eventually we'll be here. We'll see how we're able to expand that. The main surveillance testing that we are doing is in nursing homes and long-term care living facilities. So we are testing every patient and every staff in nursing homes. We accomplished that several weeks ago, and now we're working on retesting. And we are working on the other long-term care living facilities, such as personal care homes and assisted living homes. There are 1,200 or more of those. So it's a little bit of it's a huge project. So we are working with DHS, Department of Human Services, on accomplishing that. But we want to make sure that there are no health disparities in terms of the ability to get tests, and that minority populations, vulnerable populations, urban populations, and rural populations have the ability to get those tests. One of the challenges right now is the lag time to get a test result. That's due primarily to national companies, particularly Quest. They are doing somewhat better than they were a couple of weeks ago. They've expanded their national platforms, et cetera. There's also a potential shortages of reagents and chemicals again, which is limiting some of the hospitals. So we have to work with the federal government to expand that.
I appreciate that you touched on long-term care facilities and nursing homes. We did have a specific question
Sure.
on asking if you could perhaps talk about the sharp rise in the number of COVID-19 cases in long-term facilities. That has occurred in Allegheny County and perhaps elsewhere.
Sure.
And wondering if that might kind of it might be a signal as to how this may occur in other places.
Sure. So so certainly some of the most vulnerable citizens and vulnerable people that we have are seniors in long-term care living facilities. So that would include nursing homes, but also the other long-term care facilities, as I mentioned. You have seniors who are more vulnerable to getting COVID-19 into severe cases, particularly those with chronic medical conditions such as hypertension, diabetes, dementia, heart disease, etc., that are more prone to having severe complications, and you have them in a congregate setting, many having very close contact with caregivers. So what has been very clearly shown by a number of academic experts is that the prevalence of COVID-19 in these facilities is directly proportional to the prevalence of COVID-19 in the community and county where they are located. And so if there's a lot of COVID-19 in the county, you're more likely to see it in the facility. If the county counts are very, very low, it's not impossible, but you're less likely to. Because the primary way that COVID-19 enters the facilities, unfortunately, is through courageous and brave staff who are asymptomatic through no fault of their own, are asymptomatic or pre-symptomatic, and they're doing their job, they're going to work, they don't have symptoms, but they're carrying COVID-19 into the facility, and then it spreads. Which is why our testing of everybody and doing it again and again is so critical to pick up those asymptomatic staff so they can be isolated, and to pick up the asymptomatic patients so they can be quarantined and isolated and separated from the rest of the group. So that's what we're doing now. So we had significant rates of patients in nursing homes and tragically deaths in nursing homes in the spring. Much less now. I know that that Allegheny County has had some recent increases that is directly proportional to the increases we saw in July to the number of new cases in Allegheny County. Again, through staff who, through no fault of their own, are bringing it into the facility. So we need to work on testing. We also have a new program called the RICP program. It's an acronym. Don't ask me what it stands for. But this is actually working with our academic medical centers to work with us in each region of the state to help the long-term care living facilities. So in Allegheny County, that includes UPMC and Allegheny Health Network. And they're going to be working with the facilities in terms of infection control and cohorting, and PPE, and sending staff in if necessary with strike teams, et cetera, to help those facilities. This is a new program passed by the legislature and funded and signed by the governor, which is just starting over the last number of weeks. So we're very hopeful of that.
That sounds great. And folks are wondering if you could speak to the timing of a vaccine, and when there's a vaccine, that process for communicating its availability and perhaps distribution.
Yep. So we don't know when there's going to be a vaccine. The federal government has Operation Warp Speed. And what that means is that they are actually paying each pharmaceutical company to develop the vaccine now. If you didn't do that, then one or two might do it, but it costs so much money, and they don't know if it'll be successful, that a lot of the companies wouldn't do it. So they are actually paying, I think they're highlighting 3, but paying 7 companies to develop a vaccine and then produce the vaccine, whether they know that it's effective or not. Several vaccine companies have started stage 3 trials where they're testing, where they're giving the vaccine and up to 15,000 people, and have another 15,000 people and see who gets sick and who doesn't. Those studies take time. I think it would be unlikely for us to see a vaccine this fall for widespread distribution. I guess it's possible. That would be just wonderful, but I think it's less likely. I think that it is very likely that we will have a vaccine in 2021, maybe more than one. Then our job, working with the federal government, will be to distribute it to 13 million Pennsylvanians, and working on distribution for that. So we have teams working on that right now, as does the federal government. So we'll be working with all of our health partners, whether it's hospitals and physicians, other healthcare professionals, nurse practitioners, et cetera, our state health nurses and their offices, our county municipal health department partners, the FQHCs will be a critical role to distribute the vaccine. We're going to need to get past vaccine hesitancy and people's concern about a vaccine. So it has to be demonstrated to be safe and effective. But there's so much we don't know. I mean, we don't know if it'll be 1 dose or 2 dose. We don't know if it'll be how long term it'll last. We don't know if you'll need other boosters. Will it be 100% effective, or like the flu vaccine, partially effective? So there's about 100 things we don't know. So we will find out as we continue to work with the federal government, as well as all of our stakeholders and partners in Pennsylvania. So when we have a vaccine, to message it and distribute it.
Thank you so much for explaining more about that in that process. I'm wondering if you could speak to the mental health impact of COVID-19. The nonprofits who work with us, both physical healthcare, behavioral healthcare, are seeing increased needs for those services and requests for help.
Sure. I think that there are 2 mental health issues. One is actually people who've had COVID-19. It is apparent that COVID-19, we think of it as a respiratory virus, and it is transmitted primarily through respiratory transmission and droplets, but it can infect the central nervous system. And there's more and more evidence of neurological and mental health issues for some patients after they're sort of in the midst of their recovery from COVID-19. But I know you mean because of the quarantines and the lockdowns. And I think that that's a huge issue. I think that it can be, the whole time is very stressful. I mean, we're in the biggest global pandemic since 1918 in 102 years. And so that is stressful for everyone, but particularly stressful for some, especially if you have pre-existing mental health issues, whether that's depression, anxiety, PTSD, or substance abuse issues, or any combination thereof. I think that it's been very difficult. I think that the idea of social distancing and staying home, actually it really should be physical distancing, not social distancing. We all say the same thing, but it really should be physical distancing, is very challenging for people staying in their homes for long periods of time. Lack of social contact can be really challenging. And I think that that does have an impact in terms of mental health and substance use and abuse. We are seeing concerns about the mental health impact in terms of suicide as well as overdoses. So I think that we all need to work together. The Department of Health is pleased to work with the Department of Human Services, as well as the Department of Drug and Alcohol programs in terms of the state, and working with the communities and and all the local officials in terms of trying to deal with mental health issues and expand mental health treatment. Often, which will be remote treatment, which might not be perfect, but might be very effective. I know that Secretary Smith and DDAP and Secretary Miller of DHS are working on that.
Thanks so much for speaking to that. We have a more specific question. Considering some folks, particularly with disabilities, are still in need of receiving health care, and specifically oral health care. I'm wondering if you might speak to what the Commonwealth has done or what it might be able to do to ensure that more patients with disabilities receive adequate dental care, even without undue hardship.
Sure. So we would work really closely with the Department of Human Services on that. We do actually have a state dentist, Dr. Musafarian, and she works for the Department of Human Services. And I know that she's working on that specifically in terms of access to oral health care, and particularly with those with disabilities. It was very challenging in the spring, where really most dental offices were not able to be open because of the lack of PPE. That is somewhat better now. It's not totally better now, but dental offices are open. And so we want to make sure that everyone, but particularly those with disabilities, have access to oral health care. And we'll support Dr. Musafarian and Secretary Miller in that.
Thanks for answering that. And then a bit more of a broad question. How is the Commonwealth addressing the growing number of people without health insurance?
Mm-hmm. That's a big issue with ourselves, but also the Department of Human Services and the Pennsylvania Insurance Department. So Secretary Miller of DHS and Commissioner Altman for the Pennsylvania Insurance Department. So, of course, one of the biggest things that Governor Wolf did, which was now 5.5, almost 6 years ago, in the beginning of the first term, was to expand Medicaid and under the Affordable Care Act. So we still have Medicaid expansion. We also have a very vibrant CHIP program. And we have our own exchange. And so that is really brand new in terms of the Pennsylvania Insurance Department. But instead of using the federal exchange, we have our own exchange that will hopefully be able to expand insurance for people who don't qualify for Medicaid. So we would be pleased. I know that there's a specific group with Secretary Miller and Commissioner Altman in the governor's office working on expanding health insurance. Of course, a lot depends what happens nationally in terms of that. So, we need to all advocate for the continuation of the Affordable Care Act, without which things would be far, far worse. There are some challenges with the current federal administration and the Supreme Court. Hopefully that will work, that will be fine, and we can continue to work to expand access under the Affordable Care Act.
Thanks so much for speaking to that and for including advocacy, because we know that our nonprofit sector is super important in advocating for the kinds of policies that will, down the line, protect all residents of Pennsylvania, for sure, including expanding healthcare.
Absolutely.
And this is a question that was submitted more about kind of the situation around masks and how to communicate about that and get more folks to get on board with that.
Absolutely.
So,
well,
yeah.
I think that that's something we all need to work on together. So the governor and I speak about that endlessly, and I think that that has reached some people. And sometimes people have to hear it 37 times, and then they do it. I think but I think it also has to be by the community level. I think that there are some people that aren't going to do it just because I say it, or we're not reaching them in terms of access to television or the right online. So I think that is something that we're going to be working on in terms of our messaging to other communities, to other vulnerable communities, to the African American community, to Hispanic community, other vulnerable communities. We have to have messages that speak to those people. But I think, and I know you have some specific messages as well to speak to your communities, which I think in Pittsburgh, Allegheny County, and really throughout Pennsylvania, I think that we welcome that type of collaboration to be able to get the message out in an appropriate way so that people can have access to it, that they see it and it speaks to them about the importance of mask wearing. Unfortunately, there have been public officials that have been contradictory in terms of that message. I find that untenable. It is extremely clear that wearing masks is this simple cloth mask is a pretty simple thing that we can all do to protect ourselves, to protect our families and loved ones, and to protect our community, and then eventually protect our Commonwealth. I think that I understand that people, of course, have civil rights, and that's critically important, but this is not a civil rights issue. This is a public health issue to protect all of us and to decrease the transmission of this dangerous virus. And I think that, that it is everyone's responsibility to wear a mask, and we need to work with you all to get that message out. So we're very pleased to collaborate on that. The Pennsylvania Department of Health, under leadership with David Saunders and Brian Lentis, does have our own task force, as well as the Lieutenant Governor's task force in terms of health equity. We have some specific media working on trying to make sure that we tailor the media to the community, but I think working with you all is probably the best way to access communities in your area.
Absolutely, and we're grateful to be working with you and your team throughout this process. And I want to let folks know on the call that we've received several questions, additional questions in the chat, and we'll make sure to send that over to your team so we can get some additional answers. So thanks for that. But finally, I want to ask, outside of overcoming COVID-19, what are some other priorities for your office, Dr. Levine?
Sure. So other priorities that we set beforehand which continue today. One is addressing the opioid crisis. And so that is through the Pennsylvania Department of Health, but then through the whole administration. And it's not just opioids, overdose crisis. That includes DDAP and DHS. Really, the whole opioid task force is all continuing. They met today. Virtually, of course, and the overdoses have continued and strike every community, whether it's urban, suburban, or rural. And so we need to work to continue to address the disease of addiction and make sure that we continue our prevention efforts, to make sure we continue our rescue efforts with the distribution of the life-saving medicine naloxone for opioid overdoses, and then continue to expand access to treatment for opioid abuse, that is primarily medication-assisted treatment or medication for opioid use disorder treatment. But of course, there are many other drugs of abuse which have been leading to overdoses, particularly stimulants such as methamphetamine and cocaine. So we need to address all of that. The second has been violence. Violence as a public health issue. That was established by the governor. The governor, we had a violence task force that was led, which I know produced some specific recommendations right when COVID-19 was hitting, but that has not left our agenda and our wheelbox in terms of focusing on violence. We just put out last week a new violence dashboard on the Pennsylvania Department of Health website. So violence prevention in all of its different ways. That includes gun violence. It also includes domestic violence. It includes sexual violence. It includes school violence. It includes violence in urban areas, violence in suburban and rural areas. Violence against the self, which is suicide. So violence prevention. And the third is environmental health. Some of that is specific locally, but in the Southeast, that includes what are compounds called PFAS or perifluorocarbonate compounds, and the risk in certain areas. That includes a study that we're doing with partners in the Southwest on potential health effects of fracking and other types of environmental health issues. We continue our efforts in terms of maternal health, child and maternal health. We have a maternal mortality review committee, which is continuing, looking at health disparities and maternal health. We also are trying to work on immunizations for children, WIC, those type of issues continue.
Well, thank you so much, Dr. Levine, for sharing your time with us today, as well as all of the very helpful information. We're grateful to you and your department for all the work you're doing in collaboration with us and our communities. So thank you very much.
Thank you. Continue to have a wonderful meeting. Thank you for all your collaboration. I really appreciate it. Bye-bye now.
Thank you. Have a great day.